Hi, Nick. Thank you very much for joining me today. Would you mind introducing yourself?
Hiya, thanks for giving me your time, Gabby. My name's Nik Sethi, and I'm a private dentist working in London and also in Essex. And we run an education academy also aimed at bespoke education for dentists of all ages, either young or not so young like myself. I still feel like I'm young, but not as young as I used to be.
Perfect. Well, you've kind of just you've done a bit of my job for me there. I was going to say, right, today we're going to be talking about postgraduate education, etc., etc. So yeah, so postgraduate education is obviously something that's super important to you. So could you tell us why this is? Why do you think this is something that people should really consider after university?
There's a few reasons actually. It's like passing your driving test. Yes, you've got that license and you're able to drive, but you don't necessarily have the confidence, which is the big thing. You may not have the skill set, and also just have that camaraderie. It's a funny time with our profession. I've been qualified since 2009 now, and before the pandemic, it was very different, especially when you're qualifying through university. Now, dentists that are qualifying now that have been through that lockdown stage, they've qualified with much less experience than perhaps what we had, and I qualified with less experience than dentists before me. And they're coming out to a pandemic, post-pandemic, where patients are more worried than ever, more demanding than ever, and dentists are less confident than they have been in the past. So it's a really scary environment for a newly qualified dentist out there. And essentially, postgraduate education, the right courses, should be there not just to deliver you a higher skill set, but also to help you get confident and help you share your experiences and talk to like-minded professionals. Because it's a wonderful profession, but it can be quite lonely. You're stuck in the surgery with one nurse, and if you're not careful, you end up not talking to colleagues around you, and quite soon you can end up feeling quite isolated. So, postgraduate education for me was not only vital to improve my clinical skills and broaden my horizons, but also just to share my failures and say, look, I'm struggling with this. Are you having the same problem? And it was nice and comforting to know that most of the issues I were having, other clinicians were having the same problems also.
Do you know, that's a really good point. It's not something that I've ever considered before. That postgraduate education could actually sort of have quite a sort of an impact on your well-being as well, and how you feel in the profession. Particularly, like you said, at the moment, I can imagine there's a lot of young dentists coming out of university feeling quite underprepared for, in inverted commas, the real world, and putting that what they've learned in theory and in practice at university, but into real life, their real life career.
Yeah.
So tell me a little bit about Elevate then. So people might know the name, but they might not know exactly what it's about. So could you just let us know what it is, why you set it up, and what you hope to achieve through it?
So what's really interesting is we were doing, during the pandemic hit, we started doing webinars for dentists just to keep their spirits up. We called it Geeking Out in Lockdown. And it was great fun. And the idea was short 10, 20-minute powerful webinars just to get people's energy up. And we took the content that we were using before the pandemic, where we were teaching the real last 5% of a anterior composite restoration, for example, how to put in, translucency at the incisor ledge, or how to do the most detailed things, because that's what we've been teaching for years. And when I go on courses, that's the bits that I want to learn. However, what we found is when we started doing webinars, people felt more comfortable asking questions privately because they could type a question, as opposed to in a room where you'd have one or two people asking a real high level question and everyone else stays quiet. So you think you're hitting the mark, you think you're giving them what they need. And actually, we realized we were totally off the mark. When we were doing our webinars, the messages that were coming through were totally different. They were about, how do I communicate charges? How do I communicate how I charge for this composite restoration? How do I talk to a patient about NHS versus private? And how do I put on a rubber dam? Which clamp do I choose? We realized that we've been focusing on that last 5% of the clinical journey, and there's this whole emotional and foundation journey that we've totally missed out. We've forgotten, and we've taken that for granted, being 10 years and so unqualified. And myself, my brother Sanjay, and Professor Riaz Yar and Dr. Elaine Mo, we actually realized that we need to go right back to basics here and focus on all of the pain points that dentists are struggling with. So we put out a survey and we said, what do you want to learn from us? And actually, we spent then a lot of time talking about communication, how to go through tricky conversations, like how to talk about deep caries when it could need root canal treatment. How can we stop saying things like, oh, this filling is very deep, there's a chance your tooth may die and you'll be in pain. All of these horrible things that we're taught to say, but from a patient point of view, as a non-dentist, they sound terrible. If someone said that to me as an optician, I'm going to check your eye, but I could end up stabbing your eye, going to the back of your retinal nerve. I'd be out in a heartbeat. And we get desensitized because we deal with it all day long. So essentially, our whole focus was to look at building a dentist from the ground up. Looking at communication, how we treat our patient from the minute they walk through the door, how we establish rapport, how we lower their guards, and how we understand what they need from us. And Riyadh says it great. We look at the 3 pillars of treatment planning: the desirability, what the patient wants; the suitability, what's right for them. They may come in wanting composite bonding, but they might have other issues that mean that they can't just jump to that. And finally, affordability. Can that patient afford what you're able to offer them? And is there another option that you can offer that may make it affordable? And none of those can exist without each other. We have to understand how to communicate with our patient, how to understand what they need from us, how to plan comprehensively so that we're looking at health and then aesthetic goals. And finally, how we can talk about making things affordable, whether that be through becoming more comfortable with how finance works, or how we can break treatment up through, most of my plans aren't done in 6 weeks. They're done over 2, 3, 4 years. It's no different to building a house. We're building a future for our patients. And so we wanted to create a bespoke course that takes a dentist through that whole journey, realizing that as a dentist, we are in that weird situation where we have to be everything. We have to be the architect, we have to design the restoration, we have to be the builder, we have to do it, we have to be the insurance provider when something goes wrong, and we have to be their best friend as well throughout the whole journey. It's the only profession I know where we have to satisfy all of those criteria. And so the first kind of foundations is just to get them in the right mindset and how to plan things properly. And then we want to build them up with the clinical skill set. So photography, anterior composites, posterior composites. Do we understand the different matrix systems out there, the different composite systems out there? And understanding that there's no one system that suits all. We're not system specific. We will help you work with what's in your practice. We're very aware that most of the dentists that come on our courses are associates. They may not be able to go and just spend 10 grand on materials. So there's nothing more upsetting than going on a course where you learn this amazing technique and you go back to your practice on Monday and you don't have any of the stuff available. So whilst there are some things that are non-negotiable, like I always tell dentists, if you want to do good work, you need loupes and magnification, you need an excellent light curing unit to set your composite, and you need to make sure that you've got a good sandblaster so that you can remove biofilm for good aesthetic adhesive dentistry. But a lot of the other stuff, you don't need the most expensive instruments, you don't need the most expensive accessory equipment. We can make it work within what you've got to elevate your standards. So it's making them feel comfortable that they can make an immediate change from Monday. And that's essentially it. It's building them up from the foundations, helping them elevate what they're already using in their practice, and then when they're ready, taking them onto our advanced courses where we really push them to high-end aesthetic, direct and indirect dentistry.
So people who might be watching now, they might be wondering, is this for me? Am I right for what you offer? So who are you aiming these courses at? Who would you like to see come along?
Well, the nice thing is we're not aiming at a specific level of experience. Whether you're 1 year qualified or 10 years qualified, we want to start from the beginning. We want to go through our methodology, our system of how to create that rapport communication, and our way of clinical treatments, whether it be composites or veneers or onlays. We want to walk you through that whole journey. So by the end of the year or 2 years, you feel comfortable with the whole process for doing quadrant and full mouth dentistry. So we've got, for example, we've now done 5 cohorts, and we've had dentists that have ranged from just after VT to a couple of dentists that are 20 years qualified and just feel like they wanted to just get that buzz back for dentistry again. They've been doing it for so long, they just wanted that, kick and see what's out there, what's new. And so for us, it doesn't matter what level of experience you are, we treat you the same. And whether that means you want to come on a full year course or maybe just dip into some of the short courses, we'd like to think that we can make excellence achievable to all. It's not, you'd have to be of a certain level to come to Elevate. Our whole thing is we're approachable and we like taking people under our wing.
Yeah, absolutely. I mean, that sounds like it's not sort of non-specific, it's whoever wants to kind of improve their clinical skills, regardless of how much experience they have, that this is the place for them to go to achieve that. Is that right?
Yeah, and we'd like to think so. And we like working with the practices that dentists work in as well to see, if we're asking dentists to book certain amounts of time for treatment and improve their charges, we like to talk to the principal and say, right, what is your hourly rate? If you've got your dentist coming on our course, what is your hourly rate for your business? And based on that, we can help your dentist charge appropriately. There's no point in me sitting there telling someone to charge X amount if in their practice they have to charge something differently. So we're not here to tell dentists what to do, but we are here to help them get what their principal needs from them in order to succeed, and also for them to enjoy this journey.
Yeah, absolutely. I can imagine it can be quite difficult to remind yourself to enjoy the journey when you get so caught up in the day-to-day of dentistry. I'm not a dentist, so I don't know, but I mean, it seems super stressful at times if you don't remind yourself of that.
It's any profession, right? Especially post-COVID. There's more stresses than ever in any job out there. And being a healthcare business, fundamentally, we are there to help patients. But that doesn't mean we can't enjoy ourselves as we're doing it. I love what I do. I haven't got bored of it after so long, which is why we teach. You wouldn't get into teaching unless you really enjoy what you do. But essentially, it's not all about making money. But if you're providing high level quality of work, there's nothing shameful about making a good living doing it. And so I always say to my clinicians, when we're taking on new dentists, I put them through a rigorous training format, especially at Square Mile Dental Centre. And I say, don't charge for the sake of charging. You've got to be really comfortable with these protocols. Start documenting your success, get comfortable with photography. And when you're producing work that you're proud of, then you should be proud of charging properly for it.
No, absolutely. I can see that. That's something that probably a lot of people as well find quite difficult is kind of selling, I guess, as a dentist, justifying the cost that you put on there. It can be quite an uncomfortable experience for some people. But like you just said, there's no shame in earning a good living for something that is, for many people, well, for everybody, such a crucial service.
And the reason why I feel quite strongly about both doing excellent work and, making sure that you're charging appropriately is I was victim of all this. I was terrible at charging. I fundamentally, for years, I loved what I did. I was always spending on my own education. I used to spend at least £10,000 to £12,000 a year on my own education on year courses. But I would be seriously undercharging for the type of work I was doing. And if I look back on it, it's because I didn't believe in myself. I didn't actually have that confidence in myself to charge. I'd have a certain figure in my head that I wanted to charge because I knew the level of work I was doing was good. I had 4 or 5 year reviews, I had good success, but by the time it left my mouth, it was a different figure, mental fiscal drag, because my brain didn't believe in my skill. And so that's why when I'm teaching with Riaz and Sanj and Elaine, the communication side of it, we're not teaching because we're perfect. We're teaching because I don't want young dentists to make the same mistake we did. Look, the whole purpose of any profession and just journey of life is, as we learn, we've got to make sure the next generation learn from us and become better than us. If the next generation don't become better than us, then we've done something wrong. And I'm at a stage now where I was so lucky in my career to have my brother mentor me from day one and, sorry to swear, but kick my ass into shape every day. He used to literally make me show him every case I did at the end of each day, and he would go to town on me. The rubber dam was no good, open contacts, colour match was poor. I would get absolutely obliterated. I'd go back home, look at the photos, back to the drawing board, come back again. It was like just going 12 rounds with Mike Tyson. But what it did is it put me on right habits really quickly. It showed me where I needed to be very quickly, and that, nothing else was acceptable apart from excellence. And so I've been so lucky to have that, and being part of the British Academy of Aesthetic Dentistry and having some phenomenal mentors that have grounded me along the way, helped boost my confidence, but also make sure I knew where I had to improve. And that has been such a big driving force for me. And in return, that's what makes me so passionate about teaching the next generation, because I understand that not everyone has a big brother in dentistry. Not everyone is part of an academy. And actually, it's okay to feel underconfident, and it's okay to need help, and it's okay to want guidance. If we don't ask for guidance, if we don't ask for help, we won't progress in our journey. It's not about achieving a final destination in dentistry or life. It's about enjoying each stage and learning from the failures, and giving yourself a tap on the back when something does go well.
Yeah, absolutely. I feel like just people in general are quite reluctant to do that. We're always really good at acknowledging when we make mistakes, but when we do something right, we just kind of move past it and just move on with the day. And I feel like, no, you need to celebrate those successes, however small.
Yeah, and to this day, I mean, we talked earlier about, understanding your hourly rates and charging appropriately. But to this day, honestly, a good day for me is never how much I earn. It's when I come home, put my photos up on my screen, and I see a case that I'm happy with, and I say, wow, I'm so happy that after all that hard work, this is where we got to. And equally, a bad day for me isn't because I earn £100. It's when I put up a case and I think, oh my God, I got the shade all wrong. I didn't get the shapes right. I can't believe, why did this happen? It will ruin my weekend. And my wife has had to deal with this many times. She knows when I walk through the door, when I've had a case that's gone well or a case that's gone bad, she will know straight away. But it's learning from both, learning from the failures and actually enjoying the moment when you do something well. And I've become better at that over the years. I was always my own harshest critic, but now I do take time to think, oh wow, I'm really happy with how that case went.
For sure. Yeah, absolutely. It's important. And I think if that's kind of the ethos you're carrying with Elevate, then the profession will be better for it at the end. So yes, it's a good way to be.
We hope so. I mean, our whole thing is bespoke education. Prof. Riaz Yar has an incredible experience with specialist prosthodontic training. My brother's a previous president of the British Academy of Aesthetic Dentistry, and again is all about being as ethical as you can. And he always taught me, excellence is just our standard. That has to be our motto. I've always enjoyed helping people become the best version of themselves, and Elaine is phenomenal at just making complex treatments seem simple. So between us, I do think we've got a nice way of making it all approachable and achievable, but we also keep it fun. There's loads of socials, there's activities, and at the end of the day, if you're taking time out of work, you want to learn, but you also want to be able to let your hair down and enjoy. And I don't have as much hair as I used to, but I certainly still enjoy letting it down when I get the odd opportunity.
That's great. Thank you so much. Is there anything you feel that you want to mention that we perhaps haven't covered?
Yeah, the only other thing I want to talk about is working with FMC. We've produced a really cool series which is called Mastering General Dentistry, and that's going to be available on the Dentistry site online. And we're really proud of this actually, because it's 10 to 12 videos filmed in a really interactive way. No more boring lectures with me sitting in the corner just talking for half an hour. We've got some cool animations, and we've tried to break down really stiff topics like adhesion and bonding, which traditionally make people yawn. And we tried to make it really fun and animated.
Thank you very much for giving up your time. I know it's not a very popular time to do an interview Friday afternoon, so I appreciate you joining me.
I've got an 8-month-old baby, so I don't know if it's Monday, Friday, or Sunday at the moment. It's all the same. So anytime.
I'm telling you now, it's Friday. So that hair that you said that you let down earlier, let it down. It's Friday.
We'll give it a go. I'll see if I've still got it in me tonight.
Yeah,
Let's see. Thank you so much,
Well,
Gabby. I appreciate your time.
Cheers.
Thanks a lot. Cheers. Bye-bye.